One of the premises of Strong Body, Strong Mind is that health, nutrition, and fitness are matters of not only personal importance, but also national importance. Probably nothing supports this premise more than the information currently available to us on the subject of overweight and obese Americans. Experts and the data tell us that obesity causes or increases the risk of numerous diseases and unhealthy conditions, that those diseases and conditions greatly affect the cost of health care for all of us and affect productivity in the workplace, quality of life for those affected and their loved ones, life expectancy, and even have impacted the eligibility of many for military service. More on all of that shortly. Let's move on to some data. In the last 20 years, and especially in the last 12 to 15 years, the percentage of obese adults, defined as ages 20 and above in the U.S., has accelerated at an alarming rate. I find this very troubling, especially when you consider the wealth of information about exercise and nutrition that has emerged in the last 20 years and that is so widely available. The most recent data available, and one source of this data is the Centers for Disease Control and Prevention, or CDC, indicate that in 2010, 36 states had an obesity prevalence of 25% or more, and that 12 of those 36 states have an obesity prevalence of 30% or more. According to the CDC, overall, about 1/3 of U.S. adults are obese. 1/3. About half of that percentage, or about 1 in 6, children and adolescents, ages 2 to 19 in the U.S., are obese. I'm not talking about overweight here, I'm talking about obese. We'll discuss the difference shortly. As recently as 15 years ago, all states had less than 20% obesity prevalence, although an increasing trend was already in place back then. Now, a word about these numbers. They are derived from what the statisticians called representative samples of the population. They are not based on data for each individual in the United States. However, I have not come across any challenge to the validity of this obesity data, and I'm not a statistician, so we'll accept these numbers as statistically accurate. The numbers we've mentioned so far are for obesity. The numbers for overweight are much worse. According to the World Health Organization, more than 1 billion adults worldwide are overweight, and at least 300 million of them are obese. These numbers are from several years ago, and staggering as they are, they do not include overweight and obese children, only adults. I do want to clarify the measures that are used to define overweight and obese. Overweight is defined as a body mass index, or BMI, greater than 25. Obese is defined as a BMI of greater than 30. BMI is based on a relationship between height and weight. It does not distinguish between fat mass and fat-free mass. BMI by itself does not distinguish between men and women. For these reasons, BMI by itself is not as useful as body composition. By body composition, I mean a gender-distinguishing measurement of percent body fat, the ratio of an individual's fat mass to fat-free mass expressed as a percentage. Waist circumference, or hip circumference in women, would also be a useful metric. Now, at 5 feet 11 inches, one would have a BMI of 25 at about 180 pounds and be considered overweight at any BMI above that level. However, a fit 5 foot 11 inch male weighing 180 or 185 pounds with a substantial amount of lean muscle mass and a 30-inch waist, for example, would not be overweight in the real sense of the word, despite the BMI of 25 or above, but would be considered overweight solely on the basis of BMI. That's not to say that the overweight BMI data should be ignored. It shouldn't, because unfortunately, most Americans with BMIs over 25 do not fall into the athletic or fit low body fat classification. But again, the alarming statistics we presented are for obesity, for BMIs above 30, and that data is much less likely to be affected by the low body fat hypermuscular individual if you are being representative of the national population as a whole. The overweight and obesity data do not provide any information about prevalence for specific BMI values between 26 and 30, or for specific values above 30, only for above 25 as overweight and for above 30 as obese. By the way, an interactive BMI calculator can be found at obesityaction.org, the website of the Obesity Action Coalition. Okay, back to what is being called the obesity epidemic. What are the consequences of this epidemic? Well, according to the World Health Organization, or WHO, the medical and health consequences can include respiratory difficulties, joint problems, cardiovascular impairment and disease, type 2 diabetes, and certain types of cancers. Of course, one's overall physical fitness is greatly impaired too. The WHO reports that 90% of all persons afflicted with type 2 diabetes, including children, are obese or overweight. In combination with other risk factors such as smoking, high blood pressure, or high cholesterol, obesity, which is already potentially deadly by itself, can be even more deadly. The Society of Actuaries reported in various studies and papers that, as of 2009, the total economic cost of overweight and obesity in the United States is $270 billion per year, while the cost in Canada is about $30 billion per year. The $270 billion per year in the U.S. breaks down to $72 billion for overweight and $198 billion for obesity. These dollar amounts are based on an increased need for medical care among the overweight and obese, loss of worker productivity due to higher rates of death, and loss of productivity due to partial or total disability. These increased costs to employers and insurance companies potentially affect all of us. In 2010, retired Rear Admiral Jamie Burnett, speaking on behalf of an organization called Mission Readiness, stated that only 1 in 4 Americans ages 17 to 24 are eligible for military service, and that obesity is one of the main reasons. Since 1995, the number of recruits who failed their physical exams because they were overweight has risen by nearly 70%. The military discharges more than 1,200 first-term enlistees each year because of weight problems. It costs the armed forces about $60 million a year to recruit and train replacements for these 1,200 annual weight-related discharges. Mission Readiness, which is led by more than 200 retired generals, admirals, and other senior military officials, calls this an epidemic which threatens national security. The prevalence of overweight and obesity now seen by our military and by our military recruiters is unprecedented. More information about Mission Readiness, including a copy of its report, Too Fat to Fight, is available at missionreadiness.org. The causes of overweight and obesity include increased consumption of sugars and saturated fats, and little or no exercise. What you eat or drink in the case of sugar-loaded beverages, the timing of when you eat, portion size, and again, physical activity and exercise are huge factors. There are many foods which we know are junk foods, yet unfortunately, many Americans eat them anyway. However, there are some foods which are disguised as healthy, but which because of sugar content or because of dressings or other add-ons, end up being more unhealthy than healthy. What can you do to ward off overweight and obesity? Consult your healthcare professional and your nutrition and exercise professionals. Eat and drink healthy, exercise consistently, and watch Strong Body, Strong Mind for helpful information. If ever there was a time when health, fitness, and nutrition were matters of national importance and even national security, that time is now. Thank you for watching this segment of Strong Body, Strong Mind.